Welcome to the trauma station. Your patient is a 29-year-old female who was hanging Christmas lights when she slipped off the roof and fell on her left side. There's obvious deformity to her left arm and there's moderate bleeding.
Okay. BSI is the scene safe. Okay, so I'm going to determine the mechanism of injury, and the patient fell from the roof while hanging Christmas lights, and she landed on her left side. Is this my only patient?
Yes.
Okay, so this is my primary patient, and I'm going to call for ALS, and then I'm going to stabilize the C-spine. Can I pass this off to EMP assist?
Yes.
Alright, so I'm going to determine her level of consciousness. Hey, are you okay? There's no response to verbal stimuli. Now I'm going to try some painful stimuli. There is a response to painful stimuli. And then I'm going to determine the chief complaint. If she were awake, I would determine the chief complaint. And then I'm going to determine the general impression. She seems warm and dry.
She is cool and clammy.
Okay, noted. And then there's also an open fracture on the left arm, and I'm going to have an EMT assist splint and control the bleeding. Perfect. Okay, so I'm going to open the airway via a jaw thrust, and I'm going to insert an oral adjunct.
She rejects the
I'm going to remove the oral adjunct. I'm going to assess the breathing. The breathing seems to be rapid and shallow. I'm going to apply a non-rebreather mask and set the flow at 15 liters per minute. And I'm going to ensure adequate ventilations. And I would treat any injuries that may compromise breathing.
There are none.
There are no injuries. Okay. And then I'm going to assess this, or I'm going to do a blood sweep. Okay. And then I'm going to assess the skin. The skin is cool and clammy. And then I'm going to take the pulse. There is a pulse. So I'm going to treat for shock. I'm going to cover her up with a blanket to keep her warm. And I've already applied the oxygen. Okay. Because the patient is in shock and has an open wound, I'm going to initiate rapid transport. If the patient were awake, I would ask her for her sample history, which is signs and symptoms, allergies, medicines, previous history, last oral intake, and events prior. And then I'm going to take her vital signs. So we're going to take the blood pressure on this arm. Okay, her blood pressure is 100 over 72.
Blood pressure is 82 over 56.
Okay, it's very low, indicative of shock. And then I'm going to take her pulse and assess her breathing. Okay, her respirations are 13 and her pulse is 78.
Breathing is 26 and heart rate is 98.
Okay, that's also indicative of shock. Okay, so now I'm going to palpate the skull and face for any deformities or bleeding. I'm going to check the ears and the nose for CSF. I'm going to check the eyes for pearl. Okay. So I check the eyes for pearl, and then I'm going to remove the mask and assess the mouth and look for any missing teeth, any bleeding, and there is none. And check the nose for CSF. Place the mask back and ensure that there's still adequate ventilations. And then I'm going to check for C-spine step-off and check for JBD and tracheal deviation. Okay. So I'm going to palpate the sternum, and then I'm going to auscultate. going to palpate the ribs, looking for any like broken ribs or tenderness. And then I'm going to palpate the abdomen. So I'm going to move it like that. I'm palpating the abdomen for any tenderness, rigidity, swelling, bruising. Okay, so I'm going to contract the pelvis. And the patient groans, so there's pain with contraction of the pelvis, which could indicate a fracture or internal bleeding. And then I will assess the genitalia if necessary. And then I'm going to go on to DOTS and PMS, checking for deformity, open wounds, tenderness, and swelling. I will check for, there's the patient groan when I touched her ankle, when I was palpating her ankle. So that's indicative of a possible sprain or a break, and I will have my EMT assist manage that. So I'm going to splint the ankle because there's a possible fracture or sprain. So I'm going to stabilize the ankle. I'm going to pass this off to my EMT assist. Check for DOTS and PMS. And then I'm going to move on to DOTS and PMS on the left leg. Again, checking for deformity, open wounds, tenderness, and swelling. And check for a pulse. There's a pulse, and I'm going to pinch the toe again. And there's a response. So she has motor sensory of both feet. I'm going to cover her back up to keep her warm because she's in shock. And then I'm going to move on to DOTS and PMS of the left arm. So deformity, open wounds, and there is an open fracture. Cautious of that. And I'm going to check for PMS. So there is a pulse. I'm going to pinch the finger. She responds to a pinch of the fingers, and there's motor sensory. Then I'm going to do DOTS and PMS of the right arm. Okay, and then I'm going to check for a pulse. There is a pulse, and I'm going to pinch the finger, and she responds to a pinch of the finger. Then I'm going to palpate the thoracic and lumbar vertebrae. She groans when I palpate the thoracic vertebrae, so I'm going to note that. And that could either mean a fracture or some internal bleeding. I'm going to cover her back up to keep her warm. Then I'm going to manage any secondary injuries and